What does gas contain? Most of the time, when you pass gas, you don't realize. Other people also don't realize. Correct? You make little sound which only you know. Correct? And then you look around. Or a person who has passed gas, is little stinking, is the first one to look around. Anybody has smelled, or is only me who has smelled the gas. Correct? So it contains mainly nitrogen, oxygen, carbon dioxide, and hydrogen. So this is non-smelling. It does not smell. If you have more of a hydrogen, then you are explosive. You make little sound. Correct? And people know that you have come. Chatur in 3 Idiots. Correct? So it is hydrogen basically. But if it smells, there is methane. So hydrogen and methane combination is loud, and people know that they have to avoid next time when you are there. Correct? So this is a methane. Nitrogen is usually predominant, so no smell. Oxygen is very low. With the carbon dioxide and hydrogen in high amount, okay, still no smell. But methane gives a very bad smell to the gas, and that's the important thing. But where do you get gas from in GI tract? Almost 90% of air in the GI tract comes from the aerophagia. 90%. 90% we all have that gas is from the aerophagia. And aerophagia is psychogenic aerophagia or rapid gulping of the food or rapid drinking. So rapid drinking, rapid eating of the food, you got aerophagia. Intraluminal gas production by bacteria is 1 to 5%. And another 1 to 5% is diffusion of gas from the gut wall into the mucosal blood vessels. So mucosal blood vessels releasing gas into the lumen is about 1 to 3%. So almost 90 to 95% gas is still from the aerophagia. So what you take from the mouth, that only comes out from the rectum. So you don't have to worry about that. So problem with the gas. How do you approach gas? If you have a gas, examine very carefully. What are you going to examine for? 4 or 5 things. Number 1, hiatus hernia reflux disease. Number 2, chronic liver pathology. Number 2, 3, gallbladder pathology. Number 4, pancreatic pathology. Number 5, small bowel malabsorption syndrome and small bowel pathology. Lastly, diverticulosis of the small bowel and colon. There are 6-7 GI pathology that can produce gas. So now, when you have physical examination, person is having the eructations, gas with lot of eructations, you have a GERD. Reflux disease and hiatus hernia, so that's the aerophagia. When you have bloating and flatulence, he is not having eructations but flatulence, then exclude lactose from the diet, the symptom stops, he has got a lactose intolerance. History is what? In the lactose intolerance, he is the executive, he stays at Bandra, he is working at Nariman Point, he leaves his house in the morning 8 o'clock, he has a glass of milk, there's nothing much to it, so glass of milk he takes his car, and by the time he reaches his office, he passes 1 or 2 loose stools and lot of gas in the GI tract. Lactose intolerance, milk. So, milk or a children milk, you stop the milk and the symptoms improve. Even after stopping lactose, the symptoms continue, you go to the other carbohydrate which are not absorbed from the GI tract, and we'll discuss that little later. If the gas is severe and moderate to severe gas, just take an abdominal X-ray. Abdominal X-ray is abnormal, small bowel appears abnormal. Think of small bowel obstruction. If this is normal, but abdomen is still distended, look at the fat, abdominal fat, or ascites, liver pathology, and you do sonography. If there is ascites, liver disease, if there is a fat, it can be pancreas related or again liver related. That is, fatty liver can produce a lot of gas. So now we go to the carbohydrates which are not absorbed from the GI tract. So again, we have got the GERD, hiatus hernia, lactose intolerance, and we have got intestinal obstruction here, and got a liver disease or pancreatic disease here on charting. If there's nothing is here, symptoms with the diet probably, then we approach that. The diet, you see, person has lost weight, there's a fever, there's a hemoglobin low, WBC count is abnormal, ESR is abnormal. Think of organic pathology, there's a malabsorption syndrome or there is an intestinal obstruction, small bowel obstruction. In these conditions, TB abdomen, giardiasis, or stricture or malignancy or lymphoma is most likely, small bowel pathology. If symptoms are chronic but all x-rays are normal, CT scan is normal, we suspect a functional problem. And this is a chatur of 3 here. It's an irritable bowel syndrome. And irritable bowel syndrome, will continue to pass platters and will continue having symptoms. So this is a non-ulcer dyspepsia with irritable bowel syndrome. So with a diet-related gas, it is the malabsorption syndrome or small bowel pathology like stricture, tubercular stricture, lymphoma, malignancy, or there is a probably adhesions and obstructions. And all this is not there, everything is normal, barium is normal, then sonography is normal, then this is irritable bowel syndrome.